So welcome on behalf of PUCL. PUCL is the largest human rights organization in India. It began in 76 during the emergency and continued working as an organization for civil liberties and democratic rights. Even after the emergency was lifted in 1977 as the PUCL-DR. The organization was rechristened as PUCL in 1980 and has been working tirelessly across the country striving to defend civil liberties and human rights of all members of society. Now let me welcome the speakers on the panel. We have Dr. Chandra Venkatraman, who is a professor from IIT. She's been working in the field of air pollution, and then, as far as I know, she's one of the world-renowned experts in this subject. So we are very honored to have her. We have also Dr. Priti Meshram. She's a well-known doctor practicing in the field, and she is going to be talking to us about the health impact of air pollution. The member secretary of MPCB could not come, but he has deputy regional officer, Dr. Andhale, represented. So let me welcome Dr. Andhale also. And last but not least, we have Mr. Prasad Khale from the Conservation Action Plan. And he is going to be talking to us about, from the NGO perspective, what can be done to improve air quality. Now, we all know what the problem is. We all know what's happening to us and our lives in Bombay city. And the whole purpose of this panel discussion is to try and find out the solution and what we can do to improve the quality of air that we breathe. And the way the discussion is going to be structured, all these speakers are going to get about 7 to 9 minutes as an introduction, first round, followed by another 5 to 7 minutes, second round. We will have interventions from the floor. We are very lucky to have Sumaira, Abdulali, and she will be talking to us about firecrackers and noise pollution. We also have a group of people from Govandi who are fighting ready concrete plants in the neighborhood, and they've been at it for several years. They will be talking about the problems they have been facing and so on. And then we will open the floor for question, answers and discussion. So, who would like to begin? Priti?
So good evening everybody. As Mr. Goenka said, I'm Dr. Priti. I am a pulmonologist and based in Khale Hospital. So when I was asked to participate in this talk, I thought it was relevant because what I found was in the past 2-3 months, especially in the winter months, we end up talking a lot about AQI. We end up, as doctors, getting a lot of our patients into our OPD and in our wards with a lot of respiratory ailments. So what is happening? What is happening in these 3 or 4 months? I'm sure it's happening throughout the year, but it's something that kind of, worsens during this time of the year. I think it's more to do with the temperature causing the droplet sizes to become larger and remain in the lower layers of the atmosphere. I'm sure you know all about it. We end up talking a lot about AQI, we end up talking a lot about PM sizes, PM10 and PM2.5, I just briefly tell you what all these things do, okay? So in my OPD, I have patients who are known asthmatics, okay? Known asthmatics, known COPDs. Throughout the year, they would be coming to me once every 2 or 3 months, but now during winter season, they're coming to me every 15 days, getting bad, I need to admit them, So what is happening is their underlying respiratory diseases are getting worse during this time of the year. Okay? The other things that I see is, there are certain patients who will come to me only during this time of the year. They're absolutely normal in between, but they say, okay, I'm more breathless, I'm getting a bad cough that is not going away. So what has changed in the past 3 months is that the air quality has gone down. Okay? That is the only thing that has changed as compared to the remaining 9 months of the year. In fact, the best season for patients with airway disorders is monsoon when the air is absolutely clean. Okay? So then comes the whole thing of PM10, PM2.5. So what is PM10, PM2.5? We all know now here, but let me tell you what these particle size mean. So PM2.5 are the really smaller ones, so we have the lungs. I'm going to talk about the lungs, and the source of entry of these particles is through the lungs into our entire system. Okay. So the 2.5 and smaller particles, the vehicular, the diesel exhaust, it emits particles the size of 1 micrometer. Okay. So what happens is from the alveoli, it enters the bloodstream and goes all around the body. Okay. So it's not only the lungs that they get affected, but through the smaller and smaller size, it goes all around the body because it's something foreign. So what happens? The body elicits a reaction. It's an immune response that the body elicits to all these circulating small size particles. Okay. So we have effects of these particles being seen in the brain, being seen in the heart. If a woman is pregnant, because there's an immune response, the blood supply to the baby, kind of becomes less. So we have small size babies. So overall it affects the cardiovascular system, the nervous system. If a woman is pregnant, it will affect that as well. The larger size particles are the particles that affect my set of patients. They cause irritation of the upper, because they're not going to actually go down. Our airway system is very well, kind of designed to filter most of the particles, most of the particulate matter that we breathe, but only to a certain extent. Okay. So 10 micrometers and above, they kind of get filtered and we pop them out, but 10 micrometer and more, they'll go still down. 2.5 and go further down. What do? Is they cause a lot of irritation. Okay? A lot of irritation of the eyes, the upper respiratory tract, and the patients come to me with a chronic cough and shortness of breath that kind of does not go away. Okay? So it's fine, okay, it's there for these 3 or 4 months, and you feel okay, the summer comes, the air quality gets better simply because the ground is heating up more, the particle size are getting smaller and they get dispersed, but they're still there. So there are a few patients who, if they're chronically exposed to this, end up with chronic airway disorders. And the smaller particles would eventually give rise to a lot of chronic ailments. Okay? So as a doctor, my concern becomes, how do I see to it that, or how does the patient not end up breathing, these kind of pollutants, so this kind of particulate size that is eventually not only affecting the lung but also going to affect the entire system. Okay, so this is from my perspective, because when I see air pollution and when I for the past 2-3 years, COVID actually has been a boom in kind of, I'm not saying boom in that way, but it has kind of cleaned up the atmosphere of it. And it also helped us understand that we have to wear masks. Okay. So I advocate a lot of mask wearing in these seasons particularly. So, but beyond that, it becomes a challenge as to how do we take care of really, the environment that is around us.
So I'm Chandra, Venkatraman. I study air pollution, climate change, particularly the particles that are in the atmosphere, and we approach it both from observations, emission estimation and running models to kind of ask these kind of questions as to what is the scale on which air pollution exists, where are the emissions coming from that can affect the level of pollution load in a city, and of course source by source, what is the quantitative amount that each source, when the emissions are on, does it affect the air pollution load. Now these are all things that need to be known in order to devise effective control strategies. Of course, we are seeing in the last several years that there is a increase in the number and the frequency of high air pollution days in winter, particularly in Mumbai. And that is something that we're observing visually. We are also, it's being recorded by the monitors, it is being talked about in the press and the media and so on. Indeed, there are very interesting atmospheric motions that can bring pollution, confine it closer to the ground, that can, when it is confined, cause reactions to form more particles and so on. But the primary thesis is that if we are not emitting continuously, this concentration of pollution will not really occur, and therefore, while the atmospheric motions can worsen air pollution, the solution to air pollution has to lie in curbing or controlling emission sources. Yet the question remains, which emission sources and on what scales? So there's been plenty of work that the Pollution Control Board, NEERI, others have done, and the scientific community has done to understand what are the sources impacting air pollution. Now, to give you some sort of perhaps a little startling newer kind of findings is so far air pollution has been looked at. Okay, let's start with this PM 2.5, the ones that are the most dangerous and get right into the system through the bloodstream, etc. It can, and all of us are aware, it can be seen as smoke particles plus dust particles plus gas to particle conversion, which are called secondary particles, which is really your sulfur dioxide and NOx converting into particles, right? The smoke particles and the secondary particles stay in the atmosphere for the longest times. And when we see very, very bad air pollution days, it is that there is a transport of these from larger scales and then a confinement and then further production of the secondary particles, right? So what are the scales from which transport is occurring? So we did an emissions inventory, which is all the emission sources, how much are they emitting all over India at 5 kilometers. This is funded by Ministry of Environment. We are ready to go public with the data sets, and we are very happy to work with the government. Of course, it is a government project itself. Some startling findings are, if you take the 19 non-attainment NCAP cities in Maharashtra, right? And we calculate what is the total emissions from them and compare it to the emissions from Maharashtra itself. Then, primary particles that are emitted as such, about 20% come from the cities, but 80% are emitted outside of the cities. The gases, SO2 and NOx, about 30% come from the cities, but 70% are really emitted from outside the cities. So we really have an urgent need to expand our focus beyond city level to at least city plus state level in order to start devising more effective controls, right? And when these emissions, I told this to you from an emissions point of view, when we run them in models and ask the question, how much of Mumbai's PM 2.5 arises from emissions in Mumbai versus emissions outside, which are called transboundary emissions. Roughly, and I am telling you annual average, winter will be more. Roughly half of the PM 2.5 load in Mumbai comes from transboundary transport. This is true of Mumbai, this is true of Delhi, this is true of even big cities, that we can solve perhaps half of the air pollution problem by looking only within the city. But we really need to, in addition, look on the state scale or on larger scales to be able to solve the rest of the air pollution problem effectively. So this is one takeaway. that I would like for us to all consider. There's another, sort of takeaway that we have been looking at, and smoke is a very general word. Smoke is tailpipes of cars, smoke is chula, smoke is waste burning, smoke is the coal and the wood in eateries, smoke is coal in the MSMEs, the industries, the large clusters, etc. Smoke is, all of it, right? So then how do we prioritize it? One of the best practices in the rest of the world as well has been to really address the solid fuel as a first level. And for the rest of the world, that switch was away from coal. Right. Here, we have two solid fuel players, coal and biomass, which is wood, agricultural residues, dung cake, which is being used. And we have an ever-growing population, and our fellow citizens have, unfortunately, do not have access to clean residential energy. So about 30% of India's population, as far as we estimate, is fully using LPG, but that is only 30%. 40% is using fully solid biomass fuels, only, no LPG. And even the remaining, 30 odd percent is using a large fraction, deriving a large fraction of their essential energy from biomass fuels. So, this kind of a transition to modern clean fuels is a just energy transition that is very, very urgently needed. It's a just energy transition. It will spare, household air pollution exposure, but also our estimates through our modeling and other studies, even measurement studies, has shown that outdoor air pollution, if you look at India as a whole, the single largest source that is impacting outdoor air pollution is biomass fuels. So everybody has to eat every day. And so if we are to prioritize sources for action, definitely within the city, the construction and the dust control is already focused on, but we can expand it to solid fuels, whether it is wood, coal burning, whether it is open fires for waste disposal, and the state and city scale, to look at clean energy provision in the residential sector.
I heard Professor Chandra ji, and I totally agree with her. First thing is that everyone is aware of AQI. Anyone wants to know what AQI stands for? Yeah, but what is air quality index? It's for like people, if I say PM 2.5 is 50 and PM 10 is 10 and so 8 to 10 parameters, you won't be able to judge as to what the quality is. Now, governments have designed a system where they design this much parameter, exposure is bad for health. So they have categorized those things, and then AQI is calculated. So whichever sub-index of pollutant, maybe 2.5 ozone, maybe SOx, SO2, NO2, or any other carbon monoxide. So whichever is high and harmful, so that is the AQI of that city. Presently we are, in Mumbai, we are much worried about PM 2.5. Again, we all face this problem, we talk about, it's like winter, and we talk about air pollution.
Sir, the AQI is standard across all countries?
No, sir. US EPA has a different set of standards.
And for India?
We have a different for India. I have those papers if you want to, I can share it with you. Ma'am spoke about length about source apportionment study, which we were lucky to get it done through a reputed institute like IIT. However, I like the most important point which she mentioned, that is this dust generated in Mumbai itself? or are we getting this pollution outside of Mumbai? What we are doing is on MMRDA, previously we used to have watershed areas. Now we talk about airshed areas. This is something new. But it will keep on changing. That's a very fluctuating thing. You cannot predict wind direction, and generally the wind in winter season for Mumbai is from east to west. So Navi Mumbai, Taloja, Turbe, JNPT. So we are facing that pollution. Because their dust is coming to us. And what we are doing is we are taking corrective measures only in Mumbai. How much will that help? That is the most important question. And every year it will be same, unless some things, like we have open area, open grounds. So if there is light, wind and dust will start, resuspension of dust. That is the biggest problem. So resuspension of dust is a major thing. So wherever possible, if we have lawns, you will not see dust emanating from a lawn. So those small things at each level also can be done. Tree plantation along our boundaries of MMRD or airshed, that is one thing. Taking action against industries or giving notices, giving directions, asking corporation to do this, they are all part of MPC. As a regulatory body, yes, we can take action. Like recently, just a few days back, High Court came strongly against us. Unluckily, we are very poorly staffed. I have only 7 officers for whole of Mumbai city total. I have only 7 technical officers. Court has asked to fill 1,310 posts within a 6 months period. So let's hope that happens and we can monitor better. Plus, nowadays the corporation has also given directions to your bakeries wherein they have asked to go for cleaner fuel, either LPG or electric oven. So these things will matter. Now there was one issue when someone said that there is some people from Chembur area for RMCs. Govandi. So if they want to ask anything regarding RMC, later. Okay. Yeah. I think the most important thing is that just looking at the solution, stopping the pollution, how to prevent it should be more important. Otherwise, we can close down all production, we can close down all construction, we can close down all RMC. Still, our pollution problem won't go. It will reduce a bit. However, this has to be changed at higher level, like plantation should be mass plantation all along the boundaries. That should be encouraged.
Myself Prasad, I work with Conservation Action Trust. To give some background, I have worked with NERI, National Environmental Engineering Research Institute, where I used to do air quality management for indoor as well as ambient air. So, what I would like to talk about is, as Andhale mentioned, about the AQI. So, we have AQI air quality index for entire India, on the basis of which they have categorized it as a good quality, moderate, and severe, like depending on the air quality index. And as per the National Clean Air Program, they were supposed to publish a GRAP, that is a Graded Response Action Plan. So, just to let you know, the Graded Response Action Plan is something that all the authorities have to follow when there is a change in the air quality index. When air quality index changes from good to moderate, they have to take certain actions to mitigate that. If that is going beyond moderate, then they have to take further actions. But unfortunately, like I will just show you, it's just a 3-page document, the Graded Response Action Plan. And the major problem is, it is going like the actions to be taken are given for the severe in the beginning, instead of it has to be a reverse manner, where they have to give the guidelines for what has to be done after air quality changes from clean to moderate. Secondly, as per the National Clean Air Program and the NAQM, that is a National Ambient Quality Management Program for entire India, there are guidelines that even moderate air quality is problematic. It's not like that moderate air quality is good enough. So the graded response action plan completely fails to mention the moderate air quality, what action has to be taken at that level. Because it is very important that you are taking actions at that stage only so that the air quality do not degrade further. Then the other actions to be taken when the air quality goes down are like, they just mentioned that they have to stop some construction works, or they have to stop the entry of trucks or other heavy vehicles in the city. Then they have to follow the odd even guidelines for the vehicles to be entered in Mumbai. But the problem is the action to be taken and how it has to be implemented. It doesn't talk about that, how operators are going to actually implement that. Then, as Professor Chandra was saying that it is important to switch to the cleaner fuel from coal to gas and all. Unfortunately, I will just like to point out one thing, that in Mumbai, in Tata Bombay, everyone knows that there is a Tata thermal power plant. They wanted to change from gas to coal, calling it as a modernization. And our ministry gave them clearance for the same, that they can change it from coal, like gas to coal. I mean, which was obviously challenged, and because of that challenge, they are not going ahead with that particular thing. But then this is the reality, that even ministry is not looking into what will be the impacts. Already Tata Bombay, that Chembur area, we call it as a gas chamber, and they are proposing to convert clean air, which is there already, clean gas fuel that they are using, to the coal. That was the major issue. And secondly, I also wanted to ask the doctor that, like you said, that there is an increase in patients' number and during winter season or like that. Unfortunately, suppose there is a death of any person due to bad lungs or any impact on them, under the death certificate usually it comes is because of whatever disease is there. But if cause of that disease, it never comes in picture.
This is something that we were discussing before the start of this talk. So what the whole problem is that it is all an indirect effect. Okay? So you have patients of chronic kidney disorder, so you have patients of asthma, they come to you with a flare-up of the disease. The only documentable thing, the only documentable association in the medical literature till now has been labeling COPD as something because of biomass fuel, and that too because of studies from India, is to label COPD as non-smoking COPD in females who are using biomass fuel, or in an area where people use a lot of biomass fuel. That has been the only, documented association. Otherwise, most of it is an indirect effect. Okay, so the patient is either going to come with a worsening of his respiratory symptoms, or as I told you, if the smaller particles do go into the circulation, it may either affect the heart and the patient is going to come with a heart attack or a myocardial infarction, or the patient is going to have neurocognitive disorders, or the patient is going to have a stroke, or the mother is going to have a low birth baby. But these are all indirect effects. So we cannot really say. The only thing that would be feasible is documentation of similar diseases in cities which are more polluted as compared to cities which are less polluted. Then only we would be able to say, okay, this city is more polluted, the PM size of the AQI is so much, the PM size is so much, and you see more of these cases as compared to maybe a city where the pollution, the AQI is lower and you see fewer of those deaths. If we have a head-on comparison in a similar way, then only we can say, okay, it is directly because of the air pollution per se. Otherwise, most of the effects are indirect, and we cannot really incorporate it in when we are either giving a diagnosis, or when we are, suppose a patient is dying, we really cannot give it as a part of our medical medical diagnosis or a medical cause of death.
Thank you, ma'am. So, another issue I just want to raise is about the monitoring of air quality index. So, the number of monitors that we have in Mumbai, I think they are not sufficient because as per if we go scientifically, there has to be one monitor in 4 by 4 kilometer grid, at least minimum one, which goes to around 90 monitors that we need in Mumbai itself. Secondly, the location of these monitors is also important. Location in the sense not only in the city where you are going to install it, but also the location of monitor where you are installing, whether it's on ground level or whether it's on certain height. So that is the another thing. Then it also comes to the calibration of those sensor-based monitors, whether those monitors are being calibrated frequently, regularly, and whether the AQI that we are getting from that particular monitors is correct or not. That is also a question.
So, what we understand now from the entire discussion that most of the air pollution, we cannot really prevent the entire air pollution, but we can only control it. There are many health effects, as I've told you. So, I think for individuals, it mostly boils down to personal protection. I know that we have this everything getting triggered when the AQI, we have higher AQIs and we start talking about 2.5, and then we have the government coming in and saying, okay, stop construction activities, or we have nowadays we also see on the roads a lot of those water sprinklers being used so that most of the dust settles down and we have cleaner air. But we can't really, listening to that, the thermal power getting converted from a cleaner fuel to a more coal-based fuel, which is likely to cause more pollution. I don't think so. We can do really much about emitting any emissions, and because we cannot really demonstrate a very direct effect of air pollution on health, it is more indirect. I think it all at the end would boil down to personal protection and to maybe when it's too polluted outside, not going outside, and if you're inside, then maybe probably try to have more cleaner air inside. So this is all what is being said, but it still remains a very, if you're using an air purifier at home, it is still a very expensive option, may not be useful for all. The other thing that we could, when it comes down to personal protection, would be using masks. But the only useful mask that help us not breathe in the 2.5 and the 10 would be the N95, which are again expensive. So I really do not know what would be a cost-effective thing, because for sure we know that we would not actually tell the construction people to stop building totally or whatever. We can't ask the fellow who's driving a vehicle with diesel. Okay, diesel is a more cost-effective fuel than the other ones. So we can't really say, because it may not be cost-effective for him. So I really do not know what's the whole thing. But as a doctor, I think personal protection. But again, personal protection is going to be a bit expensive.
I do agree that integrated response action plan, and as there is need for personal protection, the kinds of hazardous warning, the levels, the closure of schools, etc., are measures that have to be taken. However, these are all intermediate measures to adapt to the unfortunate air pollution, which we have to bring down. I think there is wide agreement within the government, within citizen groups, within everything. Let's try and meet the National Ambient Air Quality Standard. But as he said, which is unfortunately, I prefer to talk in terms of PM 2.5 because AQI is a bit confusing. One day it can be NOx, another day it can be sulfur dioxide, a third day it can be something else. It's a bit confusing. In terms of PM 2.5, the National Ambient Air Quality Standard for exposure in India is 40 microgram per meter cube. WHO guideline has been revised down to 5 from 10. So there is, and even at 5, the WHO has declared that there is no safe threshold. There is no detectable effect at 5 or below 5. But they can't say that there is a certified safe threshold, right? So given that we are seeing high PM 2.5, and in Mumbai, I'm not aware what the actual PM 2.5 readings in the continuous monitors have been. Recently, I saw the report released. Unfortunately, or whatever, I was not part of the team from IIT Bombay that was working with me for that report. But in that, there were only 2 locations, and as is pointed out, there's additional monitoring. But one sort of point I'd like to make is that measuring the level is in a way like taking the temperature of a sick person and saying, hey, they are sick. Hey, they are more sick today. Hey, they are most sick on the 3rd day. But you have to give the tablet. And the tablet is control of emissions. And other countries in the world were in as bad or worse levels of air pollution in the 1950s. And before that. They have turned it around. We have to turn it around, and we can do it. You see, for example, there's a large number of studies, one of them which showed if there was a 100% switch from biomass fuels to LPG, we have the Pradhanmantri Ujjwala Yojana. Right? Connections are given. The first cylinder is provided, but there's a massive cost barrier. People are unable to afford it. If this transition was 100%, more than 90% of India's districts will come below 40 microgram per meter cube annual average. So, how do we actually implement it? How do we track the implementation? These are all very difficult things to do. However, they are the responsibility of regulatory bodies and have been done by regulatory bodies. Citizens Watch can, help with it. But indeed, air pollution is a solvable problem. And indeed, the only tablet to cure air pollution is emission control. Right? I can respond to a couple of other things, which is, in addition to the measurements, now we have developed sort of, if you would, smart models which represent the atmosphere, which we can quickly say, if we cut this source, how much will the pollution drop? If we cut that source, how much will the pollution level drop? Now, these are the kinds of things we are very happy to work with government. We almost feel as if the analysis is, in a sense, almost more important than the measurement of the level or the temperature taking. The figuring out which tablet will work is the next step. And then administering that tablet is the hardest part, it looks like. But we have to figure out ways to do it effectively. But indeed, air pollution is a solvable problem. We can start solving it by saying we will implement coal to gas, wood to gas, etc. All open burning will be stopped, right, at a city scale, and implement Pradhanmantri Ujjwala Yojana at a state scale, right? If we take very targeted actions, if there is cooperation between these different policies and different policies that are being implemented for different reasons at different scales, we will start seeing a change in the levels. You see?
So we take the question later. Waiting question.
Should we take questions later?
Yeah.
We'll take questions later as he suggested. Yeah, I think I've talked too much. What else is a point I wanted to make? Yeah, I entirely sort of we know what needs to be controlled. We kind of have to find a way to actually get it done. This idea of and we have to go really beyond the current measures. The current measures are necessary. Nobody is saying they are not. But this idea that it's a subsidy we are providing to diesel fuel to have diesel vehicles. Nowhere else in the world are there diesel passenger vehicles. And how is it we are unable to provide the subsidy to switch from chullas to a non-polluting cooking device for 70% of our fellow citizens? And there are many papers that have been written about trying to provide useful subsidies and so on. So I think we have to get a bit smarter in the way we are doing things. The intention is there, I think across board, all stakeholders are committed to at least bringing it down to the Indian national air quality standard and then think about going beyond that. In some cases, interstate cooperation may be needed, but let us start at city plus state scale. That's the same administrative unit, if you will, right? Maharashtra and all the cities within Maharashtra. So, the cooperation should be much easier to build than, should I say Punjab, Haryana, or not say it? Okay, thank you.
See, first of all, our ambient air quality standards are very, very high to begin with. If you look at the way the whole situation is structured, we are talking about 8-hour averages or 24-hour averages, right? Which itself is a huge problem. And the first time I was looking at air quality data, which is sometime in the late 80s, I asked a scientist who was explaining this to me. I said, how long can you hold your breath, sir? And he was stunned. Because the 8-hour averages or the 24-hour averages does not capture the peaks. There are times when the air quality would go even much higher than the highest permissible level, which will not show up in the average reading. So these are questions that still remain unaddressed. The second question, which is a very important question that Chandra has raised, who will pay for switching over to clean fuel? The problem today is that nobody is looking at the cost of health impact, and the people who are suffering the most are the poorest people, because they are burning the cheapest possible fuel they can afford, right? So the poor people are paying health costs, medicine, premature deaths, loss of livelihood because they are sick, they don't get daily wages if they are sick in bed, and families have to spend their money on medicine and so on. That doesn't get factored into the cost of air pollution control and so on. So I think realistically we have to look at how we can balance health costs. And if we can reduce health costs substantially, then obviously the government should definitely subsidize clean fuel to the segments which are important.
So I would like to raise one thing, that when any permission is granted to a particular industry, say it's MPCB consent to operate, consent to establish, or the environmental clearance from the ministry, there are certain conditions. There are so many conditions listed down, which does include the mitigation measures for air quality, what kind of instruments they have to install to mitigate that. It does mention, but the problem is the compliance, whether authorities are checking the compliance of those conditions. Once the clearance is granted, once the consent to establish is granted, no one is really checking that unless and until someone is complaining about that particular sector. If someone is complaining, then authorities will go and visit to check whether the conditions are being complied or not. In some cases, there are fines which are implemented and on the particular this thing. But in my opinion, until and unless the amount of fine is higher than the amount which they have to utilize to for those mitigation measures is higher, they will prefer to continue polluting because they are okay to pay that fine and again continue operating their industry. So that is, I think, one of the major issues that we need to look into. Secondly, if we look at the amount of construction that is going on, not only in Mumbai, but everywhere, there are not only buildings that are coming up, but there are highways, there are other kind of constructions that are coming. There are no mitigation measures. If you go through any highways, you won't find any kind of barriers or anything that are installed which are mandatory to be installed to control the dust emission from that construction. As Professor Chandra pointed out, pollution is not only coming from the city, but it's also coming from the other cities, the transboundary movement that we call. We also call it as an airshed management, which is required to be done. So that part is also missing from the graded response action plan, which I pointed out earlier, the airshed management. We need to look into that. Also, about the Mumbai, what's happening is, I was discussing this with Professor also earlier, that we are blessed with the Arabian Sea for air exchange, because of which all the pollution used to go outside. That was my observation, that it used to go out, but now what's happening is, due to all high rises, all the towers, that air exchange rate has come down. It's low, or it's almost, so because of which all the pollution from the city is getting trapped, which we are observing during the winter season. And as doctor said that during monsoon there are less number of patients. It's not that pollution is reduced during monsoon, it's just because of rains, all that particles are settling down. So that is another issue. So it's not like that all those measures we don't have to be implemented during the monsoon and other seasons. They have to be implemented yearly. And another point, as Professor pointed out in private discussion, that the source apportionment studies and everything, the monitoring that has been carried out was not in the winter season, but during summer. Only May, June. That only for 2 months, and May and June. Even June will be considered as a pre-monsoon in Mumbai. So that is another problem. If we are doing source apportionment studies and calculating from these sources of the pollution, it has to be done yearly and continuously. It can't be just for 2 months and that too in such season.
One more quick point. There's been a lot of talk about GRAP, and I think you very correctly concluded now. The point I wanted to make was that if we control the emission when the air quality has become moderate or poor or something, we're not going to see a reduction of the levels really very quickly. And the point you made right now, that there has to be a year-round and a sustained switch over a period of years towards cleaner fuels, towards cleaner practices, etc., to really start seeing the reduction. That is one thing I wanted to say, that even during uneven implementation in Delhi, even with monitors being very close to the roadways, they were able to see less than 20% reduction in the air pollution levels. So I think that having short-term control measures can only give us short-term and minor changes. However, this kind of sustained control is absolutely and can deliver large-scale, high levels of changes.
May I request Sumaira, Abdulali, please come up. We all know about Sumaira's work on noise pollution and firecrackers.
I feel it's a bit of a digression to talk about noise pollution, except that it's reverberating, so can you hear me? Noise pollution is also a part of air pollution, so it's relevant, but I won't speak too much about it, except to say that some lessons can be learned from the noise pollution campaign which would inform the air pollution efforts that we are making in the city. And some of them are that if we leave it only to the authorities, we get a lot of very confusing different ways of measuring, different ways of what we should do, different kind of, I'm confused. I just put it this way. Just as a citizen and as someone after listening to everybody on this panel and listening to everything else, I still don't know what is AQI, what is PM 2.5, what I should be measuring, what I should be looking out for, and how it affects me. I have been writing to the government for the last 2 years, asking them to give us a health advisory to tell us that if we don't understand what is AQI, what is PM 2.5, just tell us in simple words, what should I do or not do today? And I have not yet got an answer from the government. In fact, I'm hearing it from doctors whose work I appreciate because my whole family is sick and everybody I talk to in this city is sick. Yet we are being told that we should be looking at transboundary pollution, which may be very valid. We all know how polluted Ravi Mumbai is. But we also know that things have changed in this city as a result of our own actions. For example, when the coastal road was first proposed, one of the letters I wrote to the then authorities was that it would block the sea air from the city. And they did not consider it at all. The only people who accepted what I said was the architects who agreed. The other thing I asked for was to give us a road-level photograph or image of what the coastal road would look like. But at that time, we were given only aerial images where we saw these 2D lines and modern-looking things. Today, the coastal road has blocked our head. And we are seeing the direct results of that. Yes, it may be coming from Navi Mumbai, but its exit route is blocked as well. Because if it's coming from east to west, well, the sea is on our west. And that's what provided us succor all these years. So I think that the most important thing we can do now is to find our voices and to say in very clear terms that as citizens of this city, this is what we want. And I did that with noise. Honestly, when I started working on noise, I had no idea what to do. But I did understand very quickly that inviting citizens' complaints and making sure their voices are heard, informing them how to make proper complaints, and partnering with the government to take account of those complaints and take the action which we can't. But however, when the government didn't take the action, we took action anyway. So people laughed at us, people told us, what you're doing makes no sense. A lot of people said these are not scientific studies, this is not right, this is not right. But with due respect to all those things, we succeeded because people's voices were heard. And that's exactly what we need to do now. We need the doctors' help, we need the help of all what I'm thinking good officers, of whom there are plenty in this country, in this city, to help us, to tell us how we should complain so that their hands can be strengthened and we can be empowered. And we need to take action in our own neighborhoods. I have heard again and again, not in my backyard. That's a sentiment I completely disagree with. If you don't take action in your own backyard, are you going to the US and going to start dousing those Californian wildfires, or are you concerned about the building which is coming up next door to you, which in your own house is called sickness? I don't want to be told at that time that please look at Navi Mumbai. I want that construction to be stopped so that my family can get well. And if each of us rises up and stops that fire which is burning, that construction, I'm not saying stop the construction or the fire, I'm saying make sure they follow all norms. And the current norms are not good enough. We have international studies of how construction can look. We were told just now about how say England, as just one example, has cleaned up its air, that's because they have been very, very, very stringent about the environmental safeguards that they take at huge cost. And we need to insist that if we want a world-class city, we will insist on world-class methods of creating that city. And we will not accept methods which will give us a world-class city after we're all dead and gone of air pollution, but we want that now. So that's what I urge everybody here to do, and to do it in whatever way you can. Don't worry whether it's small or big, you're an expert or you're not an expert. Talk to the experts, convince them, and talk to your own family, make those complaints. That's very important. Thank you very much.
For giving us this opportunity to talk about our problems at the location where we are staying in Goenka, with the pin code of Bombay 88. And we have been facing this problem for the last almost 2.5 years. And we have been fighting it with the authorities since then. Unfortunately, not much has been done, and recently we have been fighting it again very, very viciously. And I've been in touch with Mr. Goenka. He has also come to our location to see what the problems are. By the way, my name is Sumit Agarwal, and I'm a chemical engineer. And with me, my colleague is there, Mr. Salgankar. He's from JJ Hospital. So we have been both one of the leaders in our fight against this problem which we face. What I will do is just take a couple of minutes to explain the problem which we have and some of the problems which has been discussed along with the members over here, and I will take it up. And probably that could lead to a few questions or some discussions on that. Okay, so the main problem is not only air pollution but also noise pollution, which the lady has talked about, which is a part of the RMC group. And of course the cement dust pollution, because this problem which we face is because of multiple RMC plants. We had 3 RMC plants, but fortunately 2 years back one got closed down because it was very illegal in its operations. And because of our fight, we did manage to get one closed down. Okay, and RMC plant, sorry, no RMC plants. Ready-mix concrete. Cement plants, ready-mix concrete, which is the normal thing for all construction activities. So basically we are facing severe air and noise pollution due to the presence of 2 large RMC plants, which is affecting more than 50,000. In fact, probably a lakh of population, which is around that in the vicinity of 500 to 1 kilometer of area. Okay, which are residents and housing societies, multiple residential complexes, schools, hospitals, and a very large working population, because there are a couple of industrial, this area where a lot of people keep coming going every day, and they are also getting affected by the health. In fact, 2 years back, we had done a big survey where we had got a response of almost 1,000 people, wherein they have been affected, the children, the old parents, and all have been affected by health, and which we have collected and we have made some submissions of that a couple of years back. So these 2 RMC plants, they work extensively during the day and night, and the commercial reasons, and which causes a lot of pollution and constant noise pollution. Now the locations of these 2 RMC plants and operations violate the current NPCB rules in many ways, and which we have highlighted to NPCB at all levels, right from the top boss to the down, in terms of email or handwritten documented, which have been signed with them. We have got about 20 societies which have sent letters to NPCB, but unfortunately, sorry to say, sir, you are there, but no action has taken place. Actually, some action has taken place. We have one plant which has been closed for the last 1 month. So, yeah, thanks for that, in fact. Yeah, it has been closed from BMC, not from NPC. Okay. RMC plants which are violating the norms are, the first norm is the sitting criteria. which is called the buffer area from which the plant should be. And that is the earlier norms of 2016 was 100 meters, but now that has been revised to 500 meters. And as soon as you get into 500 meters, we have got more than 50,000 people staying in that vicinity, and which causes a lot of air pollution. And that pollution not only is at the ground level or this, but we are staying in a flat building which is about 20 floors, and the cement dust can be very visibly seen even at the 20th floor. You just leave your window open for 1 hour and you'll find a layer of dust. So that is a problem. Okay, that is one part of the thing. Then the working hours. Now, as per the rules of the NPCB, the ROC plants are supposed to work from morning sunrise to sunset. But these people work day and night. Okay, and that has its own set of problems. The air pollution is not controlled by their particular norms, which Mr. Prasad has talked about, that they give the approvals and then there is no monitoring and things like that. Water sprinkling and chemical dust stabilization spraying system is mandatory, but we have ourselves gone into these plants and we have not found them. And we can see these plants if we keep a telescope and things like that from our houses, and we don't find any of those things. There should be a tire washing system for input and output, but unfortunately there are no tire washing systems. There has to be a cleaning and dust removal systems, air sprinkler systems, and other things which unfortunately are not there. Okay. Or if they are there for a short period of time while some, this is being taken care of also. Now, as per the rules of the ambient air quality monitoring is required with PM10 not exceeding 100 micron per meter cube and PM2.5 not exceeding 16 micron per meter cube. These are the norms of the NPCB itself. But they do not have a twice monitoring system in the plants because it has to be monitored right at the plant level. They do not have it. In fact, 2 years back, we had a suffered app which was giving us an AQI on a daily basis, on an hourly basis. But, and we had one within the Govandi, about within a kilometer or 1.5, which has stopped 2 years back almost. They removed. So as Mr. Prasad was saying that Mumbai needs 90 AQIs, I think they have 1/10 or maybe 1/20th of that in the city. They monitor, as you said, in May, June. It should be actually monitored in November, December, January, February. The highest at the level, what Mr. Goenka said, because that is really affecting the health of everyone. In fact, myself, I'm carrying a back throat right now, and once I speak too much, my throat gets stuck. But let's see. I hope I'll be able to speak a little bit. Yeah. So there is no monitoring system over there. Then there is the noise pollution. Now, if you have an RMC plant which is working 24/7, RMC plants require a lot of raw material coming in and then things going out. So that has got heavy trucks which are 20 tonners, 25 tonner trucks which go right next to our plant. Even at midnight, 2 o'clock, 3 o'clock, and there have been times where I myself have been woken up because of the huge speed at which they go and make a huge noise. So that's again a problem over there. So the constant moving of this truck, and there are certain regulations which are there of 2000, but I don't think they are being monitored or being. So based on the various large health issues and on the humanitarian grounds, and also as a fundamental right of all the citizens of this place, we request the authorities to take up the matter very seriously. And again, we really thank Mr. Goenka to give us this opportunity to talk to a lot of learned people over here, and who can probably help us as we move forward. We get some new contacts in the system over here, which will help us to build up on some of our efforts to fight the case this. A couple of points which I would like to add further to what I have already discussed was Professor Chandra has talked about that a lot of air pollution comes from outside. Well, technically and theoretically it is correct, but in a city like Mumbai, which has got huge Arabian Sea, and there is almost 70% of the land is through the Arabian Sea, which does not have really a pollution. So most of the Mumbai pollution per se, for various reasons, which is because of the new construction and all, is all coming in from within. Right? So I don't think there is something which is really coming out. We can talk about, she's talked about 50%, I would probably put the number at 5%, and 95% is from within. And when we are talking of RMC plants within half a kilometers, it is really, really bad. And the winters are the most horrible times for us to stay. Dr. Priti has said that we should not go out, or we should have some, self-this. But if you don't go out, then what do you do in life? Just watch TV at home? That's not possible. So I think the government needs to take up issues very seriously. If it is regarding construction, then they have to follow strict rules, as people have said that in UK or in other countries. And if you go through the YouTube, you will get RMC plants which work around in many multinational, many countries outside India, with very strict regulations and norms, which in India is, I would say, not even 5%. Whether it is dust control or noise control, not even 5%.
I understand your issues. See, basically, RMC, ready-mix concrete, it's a requirement because previously we used to do batch mixing. And in batch mixing, we don't have any control. Maharashtra control board does not have. However, this RMC was the requirement of the hour because we need concrete of higher grade, M20, M60, M80. So these plants spawned in this area. Now the raw material comes from Navi Mumbai. Yeah, please. I just let me explain. Previously, this Central Pollution Control Board categorizes industries in various categories like white, green, orange, and red. White is non-polluting, green is mildly polluting, orange is polluting, and red is highly polluting. RMCs have been given green category by Central Pollution Control Board. This is not states I am talking about. The categories are decided by them. MPCB has devised guidelines for control of pollution. So 30 feet barricades, it's nowhere in the act you will see. 30 feet barricade, dust collection system, tire washing system. So these were existence. Yes, some people do follow, some people try to keep safe by not operating certain systems. I am not disagreeing with that. Now the issue is the thing has gone too far, and MPCB has recently revised their guidelines. In these guidelines, we have given a time of 2 hours, wherein the complete RMC will be in a box type. So absolutely only a door will be provided. So no dust emissions from the plant will occur. A second thing you said about tire washing. Yes, that is the major issue. Even in the tire wash, some cement slurry, something remains with it. And it dries out all the way on the road, you can say. That keeps on resuspending. That is the major issue. However, RMC plants have provided tire washing facilities. But the construction project where it goes, there is no tire cover, which has recently been included in our guidelines also. So within these 3 months, we cannot immediately stop this, we cannot stop the construction, but we have taken very bold step. We have even changed our category, which requires quite a lot of paperwork, from green to orange, so that monitoring also will increase. Yes. And regarding the working hours, as I said, we have to, I'll take help of Goenka sir. Yes, there have been complaints, but one person comes, other says, "Nahi sir, kal raat ko band tha." Neighboring, those things are happening, sir.
I don't want to actually say anything at this stage, but I will open up the question answer session. And may I request one by one, whoever raises their hand first will get an opportunity. And please ask a question specifically. Please don't give us another lecture. Yeah? Thank you.
Just 2 particular
questions.
Please mention to whom you want.
Yeah. How effective really are air purifiers, let me say, for an individual?
So if you're using air filters that contain HEPA, that is, yeah. So that would really be helpful. So you have to be very specific in not just general air filters that really, that really traps all the PM 2.5 as well. So if you're able to, but they are the more expensive ones, so only those ones are useful. And I think, as we were talking about, it is expensive and not really would be helpful to people who cannot afford it. I mean, people would not be able to buy it.
Yes, we spoke about biomass to gas, etc., and the subsidies, etc. Where do I see a public-private sector partnership emerging here? Has the government approached, I don't mind mentioning names, the Godrejes, the Adanis, the Ambanis, to start adopting these villages and making it part of their CSR, right? And the government can easily give them tax breaks, whatever the capital expenditure is, make it a revenue expenditure. So where do I see, we all say government is fine. I mean, they are the regulated bodies. I just want to know if you are aware of any public-private partnerships and whether we should pursue this effectively.
Government is very happy subsidizing Adani.
May I add to that indeed, I think that we have to make the residential clean energy into a business opportunity, and I think that it has to expand beyond fossil fuels, beyond LPG, which in any case India is importing. So other gaseous or liquid fuels, bioethanol has been very, very successful in many African countries. There is compressed biogas which is being talked about, the Satat program for the transport sector, how to bring that into residential. And there is other kinds of renewable energies. I think these should be seen as business opportunities to look at how to make them happen on the ground.
My background, I am a teacher of school children. Until about a year and a half back, I found it very challenging to explain to 10th or 11th standard students why air pollution is something that we all should be concerned about. We always felt it was a Debi, Punjab, Haryana, which is what we always heard of the television. And it was challenging to explain them in common person's language why a problem which is so far away is a problem that will affect everybody. Now that it has come a bit to our doorstep, it has become easier. But the question still remains how to explain it to people. Because as the lady was addressing sound pollution said, as a commoner, there is no easy vocabulary to deal with air pollution. When you are talking about it with lay people or when you want to address this issue with policy makers, with common citizens. 2P, 2.5, and AQI, etc. still technically jargon. Consumers are still not very conversant with it. So how do we develop this vocabulary? Second, is there any learning from how baking dealt with it? Because again, that was a problem seen to be of an extremely serious and extreme nature, and they were able to do that in about less than 10 years, 10-15 years. From what Professor Chandra mentioned, it doesn't look like there is a knowledge deficit in the country. I thought, right? So it's possibly political will that is lacking. And the fact that it is the issues in the state and a lot of action problems in India at the center as well. And my question is, have we been able to find the effective way of dealing with this? Given that it's a complex center and state issue.
Okay, two questions, two quick answers. One is common vocabulary, easily perceptible vocabulary for people to perceive air pollution is visibility. Can you see the building opposite? can you put your hand out to see your fingers, which, in North India may not be possible, in the energetic train, right? So visibility is, and, being able to communicate it in terms of taking, it's possible to clear the air in pictures and show this is how a day of this kind of pollution looks like. And indeed, we should be able to see the mountains or the hills in Navi Mumbai. We should be able to see the blue sky behind them, and so on and so forth. So blue sky and visibility may be good ways to communicate, particularly to youngsters, that indeed they're looking at air pollution, right? Then the other thing is to, we are very, very happy to work with the authorities. I think there has somehow not been a sustained partnership, not just we, I think we are all very, very happy to work with the authorities. And we need to build the interface between the citizens, groups, NGOs and the academics to come up with a common voice. And I really want to say that, talking about transplant pollution was not meant to undermine the need for within city control at all, right? It is just a way of stating that you're going to need to do both things, city plus state, to arrive at final sort of acceptable levels or being significant. So, indeed, in terms of knowledge deficit, I think that these analysis tools and these modeling tools, I almost feel like I would say, don't make more measurements unless you can use those measurements to say clearly it is this source. Like, for example, if you're making the measurement very close to that cement plant, then you know that it is the cement plant, right? Otherwise, it's almost like use models, use tools, use analysis tools, use emission inventories, use these things to go on informing yourselves what to do. And so yes, there is enough information, maybe we are not in a sustained conversation with the authorities, all of us together, to continue that and towards effect that.
Just add one comment. We are quite happy to work with the authority. The question are the authority happy to work with us? And the answer is basically no. Because people like us ask too many inconvenient questions, we raise too many issues, and we are very happy not to interact with us.
Just a comment about how to drive the whole concept of air pollution to the youngsters. So a lot of them are very tech friendly. So I don't know if you can develop I don't know if the MPCP or the YMCA is giving out real time data about how good the quality of air is. So one of the ways is, if you have something like, or an app that says, okay, your air quality is bad, go. And if you have a class on the day, where the air quality is bad, you have more students who are sick. So that kind of drives the point of the air quality is bad, and you have a lot of students who are sick because of upper respiratory tract. So that kind of correlates and makes them understand that, okay, it's all caused because of bad air. So that is one way in which we can drive. But I do not know if there are apps that would, kind of give us real-time quality of air kind of information. And maybe into those apps, if we feel, okay, I'm sick today, I'm sick with an upper respiratory illness, or my cough is worse today, or my breathlessness is worse today, that would actually help us gather data that says, okay, the air quality was bad and I was more sick today. So I would like could develop that kind of app, and the MPCP or the BMC could actually have an app where they could give out real-time air quality.
Continue. MPC wants to respond.
Madam, please have a response from you.
and we can get the AQI data of almost all small towns of Mumbai as well as the whole of India. It's online mobile, Android or and we get Samit.
Samit, S-A-M-E-R.
Yes, sir. And it will give you air quality for that day, plus it will give you the concentrations of PM10, PM2.5, NOx, for.
So, becomes a technical jargon. If you just have color indicators, so, I mean, color indicators rather than 2.5.
I'm an urban planner. So basically, I work very closely with the ground level people as well as the top bureaucrats who are running the document. So what my general observation has been, because you've heard enough already what's happening, what are the issues, citizen voices, what are the experts, scientists, everyone speaking. Now what I wanted to understand from Sir especially is that I understand the government works in a certain way, right? It just follows a checklist. Whatever the act says, whatever the guidelines say, I will just take a piece of paper and I will just see whether this particular site is, following. But there is no definite monitoring or evaluation done after a period of time. So I just wanted to understand from Sir, I know Maharashtra is still getting up, but something which is, what are the first is, what are the challenges you face? Because one is obviously the resource, you have limited resource. Secondly, anything related to technical know-how, is that something which is lacking? And thirdly, any digital intervention or something new that has been tried to actually implement this. Because there are like thousands of crores of voices pointing out, and it's very heartening or saddening to hear that there are really less resource listening to those voices.
I accept all those three things. We have presently for all of Maharashtra, we have a technical staff of 110. Most of us, some are civil engineers, some are chemical engineers, some are environment engineers. Resources, staff, trainings, requirement of latest technology. Being a regulatory body, we are more into that. Whereas we should, research wing should be there. And that can only happen if we have sufficient staff. So which will most probably will happen within 6 months. We will have full staff and we will be going forward.
Pretty short one is possible. Mr. Chauhan has essentially challenged what Professor Venkatraman has said. He said that 50% of roundabout pollution comes from outside, 50% from here itself. He said that Mumbai street-like in its shape and adjoining the huge Arabian Sea, it's in something unconsidered. I'll stop at that. Any comment on that? That will not matter. The second point is this: the points have come up that we need very stricter, tighter norms for mitigation measures. One. The second point that has come up is that whatever mitigation measures are there, they are not being complied with. Is there any solution? Third point which I have another gentleman has also talked about has not been addressed. That Beijing is an example. In 2008, it hosted Olympics. It was projected, painted as a nightmare experience. Today it's a very different from the original culture of the world. Now it's not Beijing, it is Delhi. So, what Beijing did do and whether it is replicable here to what extent.
The political thing is completely different from our level. And for example, if our leadership decides to crack down on air pollution, I can assure you the air pollution will stop. In fact, if you remember, 2 months ago, it was actually a directive from the Prime Minister's office, which we are doing this morning. And everybody in Bombay went into panic mode. And for about 6 weeks, there was a complete crackdown on all the polluting things. But as the pressure got less, everybody forgotten about it. In Beijing, the situation is quite different. Once the political leadership says this has to be done, it will get done. Because nobody can question, nobody can supplement those kind of discussions. Now, we are the Civil Liberties organization. We have been an integral part of PUCL. We have to now decide whether you want civil liberty or you want liberty with the education, or whether we can have a balance in between. That is said in the lighter note, so please don't take that back.
Okay, so I don't want to emphasize too much on this, both transboundary and the ability of meteorology to help us and so on, because there are some very interesting flow patterns. You can have the sea breeze lofting the pollution, which then goes out and the sea breeze brings it back in. Okay, so you have a pollution recirculation. So there are all sorts of things happening in the meteorology. We can't go on doing the wrong thing, which is emitting, and expect Mother Earth to help us, right? So I think there are, and I wouldn't, want to emphasize too much how much is exactly from here, how much is exactly from there. Indeed, city scale, measures are necessary. And while there was talk about, the political scale, what I understand is the transition in Beijing and in China is the closure of coal plants as well as coal usage in the residential. But they had sort of to deal with only one solid fuel, which was coal. We have to deal with two, coal and biomass. And wood. So wood is all kinds of biomass. Wood, crop residue, duncane, whichever biomass.
Also, the transition to electric vehicles was good. We were talking about transportation today. But if you look at the kind of vehicles which will allow the road and the pollution of it that fumes, the transition to EV is incredibly slow. But with your clean vehicles, public transportation, fewer buses, DST buses running a day than everybody years ago, and therefore the vehicles increase. So this is a issue also that are adding significantly. And the lack of enough monitors, it doesn't give us granular insight into what's going on. Probably part of it is intentional, don't know too much about it. But I think probably at least one square kilometer, one monitor per square kilometer should be the minimum. We should have in Bombay to be able to control.
My take on this is, if you want to solve the air pollution problem, you have to focus on public transportation, which means suburban train system has to be updated. We must have money pumped into the BEST, but system which is currently being in whatever. But I think we can plan to have a more detailed discussion on that at some later point of time.
Some clarity on this Adani green which they have in the suburbs, which is far more expensive electricity. But I think Adani also uses a lot of coal, so what is Adani green electricity about? That's one thing. Another thing is the coastal road also has huge cement factories outside which can be in body secret, so going straight into us. That's one of them. Expensive.
So totally you heard about greenwashing, right?
I thought so.
No, but also the point is now they are investing in solar power and so on, which is creating its own set of problems in terms of equality and biodiversity. But that is green energy. Renewable energy is green energy. And secondly, that RMC, that blue shell on the coastal road, that is blue shell, that there is a lot of activity going on, which is going to cement also around. Hopefully that will shut down for all the construction companies will hopefully have to remove.
That's a big
problem.
Big problem. Last time,
No, I just want to say that it's very interesting. Adani has made, worldwide very high investment in green. But his policy is, before he gets on to anything green, seriously, he will
and Sumaira and our Govandi and the audience. And I would really like to give time to YMCA. You are very generously